Hello and welcome to Talkin Telehealth. I'm Erika Grau.
And I'm Kathy Ford.
Telehealth is having a dramatic impact on the way patient care is being delivered. On our show, we'll examine how telehealth can simplify communication, improve office workflow, and most importantly, drive better patient care. In addition to hearing some great clinical stories about telehealth in practice, we'll talk about where telehealth is today and where it's going, including how the latest regulations are impacting provider operations and reimbursement. Be sure to follow us on Twitter at #TalkinTelehealth and follow us at Rhinogram on Twitter. All right, welcome back, Kathy. How's it going? How was your New Year?
Well, Happy New Year to you, Erika. I can't believe that it's already the second week of January, end of the second week of January. Time has completely flown by.
How crazy is it? Also, we're welcoming in a new decade.
Yes, exactly. Which hopefully will bring yet even more changes in the world of telehealth and policy changes. But honestly, when I think back to what was accomplished in 2019, it was pretty significant. So the good news is when we look at how telehealth has evolved, really over the last 2 years, but specifically in 2019, we're now up to 40 states in the US having what I would consider significant or meaningful telehealth policies and regulations within each state to provide care and access or extended care and access to help deal with, some of the issues such as physician shortages, physician and clinician burnout, just general access, and obviously patients with chronic conditions. We want to make sure that those continue to stay managed and if not improved. But unfortunately, what it hasn't been able to affect yet, or I'd say enough yet, is this flu epidemic. It is rampant right now. And when I see and hear that and also think back my own experience with it, it's actually shocking to me that this alone does not actually catapult telehealth. And when I say telehealth, I mean real contemporary convenient ways to service patients for situations like the flu.
Such a big story at the end of 2019. I think we both read an article that had 3.7 million cases from October to December of last year. Yeah. What a crazy number.
And I mean, it's only elevating. And so why is that happening? For a lot of reasons. Obviously, we get new flu strains and not everybody gets their flu shot and, a whole host of things. But when we look at ways to prevent or to reduce the flu symptoms, we have drugs. We have drugs like Tamiflu that when you know you are getting the flu, you need to take it. For it to work, you need to take it within the first 48 hours of those symptoms, ideally. But there's a bottleneck in this process, is it requires a physician to give that patient a prescription or a qualified clinician, depending on where you're at. So we're back to kind of the old brick and mortar story of I'm sick, I have to go into an office, I have to get dressed, look somewhat presentable, get in my car, drive to a clinic, sit in a waiting room, probably with a bunch of other sick people. And if they weren't sick, they're probably going to leave their sick because I'm sick. And sit there and wait until I can be seen to basically be validated with, yes, I know I have the flu, and now you, doctor, also know I have the flu. Thank you for my prescription. Now I need to go drive to go get the prescription, and then I can go home.
What I think is interesting is we've seen an increase of 43% of people utilizing telehealth to access when they have the flu. So they're using telehealth when they have the flu to make kind of these appointments. When we talk about 2019 and all of the changes and improvements that we've seen, I almost feel like this 43% should be higher. Why do you think?
It's nowhere near good enough, especially given the age of technology that we're in. In my opinion, why are we only at 43% with everything that is available to us? Because we're not utilizing the most convenient technology. The reality is, as we've talked about before, people think about telehealth as, your grandmother's telehealth, I like to describe it, because they believe it has to be video. You probably need special equipment for it. You may even have to go to some location and sit in front of a kiosk in order to have that consult. none of those things make sense when you're talking about providing virtual consultation and you also want to focus on convenience. People will do things when it's convenient for them. It's why we all love Amazon. It's convenient.
Yeah.
It may not even be the cheapest, but it's super convenient. It removes a whole set of activities like getting in my car, driving to Target, going and buying some things, standing in line, loading up my car, unloading my car. All of that is eliminated. So I can go do other things that add more value, that, save me money, that, I can take care of other people in my life, whatever it may be. But why is that convenience not readily available for all of us in healthcare? And what I'm talking about specifically is the usage and full adoption of asynchronous technology. And frankly, let's just speak plainly. I'm talking about texting.
Yeah.
Isn't that, how do you communicate with everybody in your life?
Texting.
Yeah.
I'm a millennial.
That's right. We established
that. Yeah, we know that.
I am not a millennial, but I also text everybody in my life for, nearly everything. It's just the most convenient way. I'm in meetings most of the day. Talking, getting out of a meeting or stepping out of, what I'm needing to do for work in order to get on a phone call is very inconvenient.
And being on video when you're sick is never appealing.
Well, no, for sure not. And if that's the only option, then that's going to eliminate a whole bunch of people for a number of reasons. And again, I want to focus on a key reason being technology, broadband. Not everybody lives somewhere where video capability is going to be possible. But if you remove video and say, oh, well, you can have a phone consult. Again, okay, so that's only when I'm available and that doctor's available. And only when the two shall meet can that consult take place. And, that's also not always the most convenient situation. I think about last year, about this time, actually. Yeah. Do you remember?
I definitely remember. You were out.
I always tell people I lost 3 weeks of my life. Literally, I did. That I thought I was dying, but the reality was that I had a really bad case of the flu. And, I'm an informed consumer and patient, and I've had the flu before. So I knew what I was facing as the symptoms were starting to set in. So I also knew what to do. And what did I do? I called my primary care doctor. And of no surprise, and I love my primary care doctor, but she's very, very busy.
Right.
I live in a city where there are actually not enough primary care doctors for the population that we have. And that's, a major city, Chattanooga, ironically enough, but that's what we're facing in many, many cities. But that being said, I call my doctor's office and I let them know that I know I have the flu. Could somebody please call in a Tamiflu script for me? And their answer and protocol was that, I needed to speak to either a nurse or my doctor, but they would take a message and somebody would be calling me back. Okay, great. I'll wait.
Exactly.
And so I wait and nobody calls me back. And so I call them again the next morning because I'm getting sicker. And I know that I have about 48 hours to get that Tamiflu in my system to start working to where it's going to truly affect, the span of this horrible flu.
Nightmare.
Yes. And so, but meanwhile, I am on the decline, it feels like. I'm calling my doctor's office and I end up calling them multiple times. And third time, I don't get anybody. I get voicemail, so I leave them a voicemail. Finally, when somebody calls me back, unfortunately, I was asleep and because I was sick. So I missed it. And by the time I actually got connected with a nurse from my office, it was literally almost the 5th day. And unfortunately, it really didn't matter if I got Tamiflu at that stage or not. And so I therefore went into full flu mode. And, of course I recovered, but it was frustrating. I really felt like I cannot believe that the only way for this to happen, of course I could have gotten dressed, driven down to an urgent clinic, paid more money than I should have to, or the health system should, have to basically support in some way. But that's, again, not convenient. And so, what about other people that have not the flu, but they have other issues that, if left untreated, that are low acuity right now, meaning,
Right.
Not life and death, but if they progress, they certainly could become concerning or chronic or worse. And again, what stops people from going? A lot of times it is the convenience part of it. And so going back to what would have been best for me is, while I'm lying on the couch in misery, to have been able to text my doctor's office, pull it out of my phone and text their office line, and somebody can then, and I can let them know, I can describe my symptoms. They know that I'm an existing patient, and they would recognize that if they're using a solution like a Rhinogram communications platform that allows staff to, they can route my message to a clinician or to the doctor, and they can from there make a decision and call in my prescription and let me know that they've called it in. I could have had somebody pick it up for me, and all of that could have transpired over the course of 30 minutes without hindering me whatsoever.
What I love about that is, not only is that convenient for the patient, but we're also keeping sick people out of the waiting room.
Such a great point.
Yes.
Because
we're not spreading it.
Exactly.
So we can hopefully reduce that 3.7 million number to something more reasonable, keeping people who are sick at home.
Especially other people that are going to the doctor because they have maybe a compromised immune system. Again, to your point, sick people should stay home or stay away from less sick people or healthy people in order to get better control over something like the flu. It really is an epidemic, and it has, there have been deaths of both children and adults, which is really serious.
All right. If you're just tuning in, you're listening to Talkin Telehealth with Kathy Ford and Erika Grau. This episode has been brought to you by Rhinogram, a leader in cloud-based HIPAA-compliant telehealth communications that connects patients, clinicians, and office administrators through confidential text-based interactions in real time. All right, so we were just talking about patient access when it comes to the flu epidemic, and Kathy was just recapping a story that happened to her this time last year. And my question for you, Kathy, is what about the people that don't have access to just walk down the street to an urgent care clinic? What is the alternative for these people? And do you think that this is a key focus for 2020?
It has to be a focus for 2020, and frankly, it will be for, I think, the next several years. I mean, let's look at what we know about the rural population. We're at about 20% of our nation's population live in rural communities.
That is surprising.
It is. And what's also, I think, surprising for most people to realize is about 30% of Americans don't have Wi-Fi.
Even more surprising.
Yes, it is. And there's quite a bit of overlap between the rural communities and the lack of internet access. And so what does that mean from a healthcare perspective? There's some unfortunate realities that we know right now. There happen to be a higher number of cases of chronic conditions in the rural communities. We know that they have a lower life expectancy. Why is that? Because they lack the ability to access care. They lack the convenience for care. Oftentimes, again, we've covered this before, but you're looking at people needing to make decisions about, do I drive the 30 miles one way to go see a doctor and spend the gas and the time to do that? Or do I spend it on groceries or my electric bill or something else that I consider to be maybe more important than my health?
Exactly.
And that's how a low acuity issue then can progress to a chronic condition, as we know. We let these things go, we don't treat them early, and they then become more severe and a bigger problem and even beyond chronic. So this is something that we all have to care about. And I think the biggest mistake, and I mean, I'm just going to be a little controversial here. The biggest mistake is I think we all go around believing that, care that we all are used to in urban communities is the same in these rural communities, and that we can actually behave the same. And what I mean by that is, the EHRs that is, commonplace in every hospital, system, practice, office, and also out in the rural settings, nearly at 100%. But the reality is the way they were designed and what they offer is, from a communication perspective for the patient to the doctor or vice versa, is through this portal. The portal is discriminatory. It is. Because why? How do I access a portal? I need the internet. And if I don't have the internet, I'm not getting into the portal. If I'm not getting into the portal, I'm not communicating with my patient. I'm probably not looking at a care plan. I don't know what my lab values were when the last time I took them. And for simple questions, if that's what my doctor offers as a way to communicate with them is to log into this portal and I have no way to do so, I'm really out of luck. And that's where the problem starts to progress. So if you don't have a portal, or if you don't have access to a portal, then what do you do? Well, I guess it's the telephone. But we've already talked about this, and we need to continue to talk about this. The telephone is not the way to deliver care and to have a successful patient engagement strategy. So if you want to engage with your patients sitting on a phone, both from a provider standpoint, especially in these rural communities, they have their own issues with recruiting. I think I read in 2016, 4% of the graduating graduating students at a medical school were planning to go into rural health. 4%.
That's crazy.
It's virtually 0%.
Yeah.
If we don't essentially start bridging that gap and dealing with the shortages, the lack of resources, and making it more convenient on both sides, then this rural health and the prevalence of chronic conditions is going to be everyone's problem.
So you see telehealth as a benefit for the patient, but also a benefit for providers as well.
For sure. I mean, let's look at what from the critical access, hospital system and provider community in these communities, what they're dealing with. So they're dealing with patient leakage. What do I mean by that? Well, they obviously want to keep patients in their communities, as rural as they are, coming back to them. As soon as those patients believe, whether it's true or not, that they cannot get the care that they think they need, they start going to other cities. And if they need ongoing care, then there's a likelihood that they may move to that city. And that, again, is the slow death of small communities. We need small communities. A lot of farming and industrial and really important jobs and goods and services are handled and managed and created in these rural communities. This has to continue. But as a provider, I want to keep my patients in my community and make sure that they know that we can provide the care that they need. So again, we're back to the topic of engagement. How do I stay engaged with a patient? Well, let's just go back to the common premise here. Everybody has a cell phone. Everybody has a cell phone. So, and whether you have a flip phone or a smartphone, all you need is cellular service. Because today there are platforms like rhinograms that allow you to engage with your patients. Patients can initiate a conversation with their provider, which is unlike so many of the other solutions out there. A patient can start the conversation. I'm worried about X. And that can go directly to the provider's office. The provider's office can triage those messages and be responsive to that patient in an unintrusive yet very convenient way. More of these rural clinical communities have to adopt alternative technologies in order to provide better access and to keep those patients in your community. Maybe the first or second high priority for a critical access community is I need to make sure my patients are not readmitting. Again, because of this population, because of the distance, just physical distance, and then the inconvenience of care when you are living in a rural setting, it's not a surprise that in 2015, 80% of the rural hospitals that participated in value-based care reimbursement plans all had penalties. So it was an unsuccessful reimbursement year for rural hospitals in 2015. And what do they point to? They point to readmissions. And what do we know about why do patients readmit? Well, all sorts of reasons, but we know some easy ones. They oftentimes never read their discharge instructions, or they get the discharge instructions, but they're very long and hard to understand. And when you're discharging between you and your care team that's helping you move back home or to your post-acute location, there's so much going on. The last thing you're retaining is, just the barrage of instructions that, that they're giving you as you're trying to leave the hospital. So we have to think of really more creative and alternative methods to get that information to the patient and to the care team so that they can keep up with those instructions and help to be a part of preventing that readmission.
And would you agree that if those instructions are buried in a portal, sometimes they might go completely unread altogether?
Well, for sure, we know they're going to, because a lot of these folks won't even have the internet to get to it.
Exactly.
So they're getting paper in their hands that gets thrown away or lost. And again, maybe it's hard to read. They're very long, oftentimes, depending. But if you're receiving discharge reminder instructions and care plan reminders via text, that's so much easier to consume. That is going to help to put your patient on a better path to success, to staying healthy at home. And again, going back to the ability for a patient to initiate a conversation. So rather than waiting for somebody from the care team to reach out to that patient, again, God forbid by phone, but even if they did it via text, they're assuming that everything's going to be okay with that patient, or that's more a proactive approach. But what if something is seemingly going wrong? I have a wound that is not healing. Rather than waiting for somebody to check in on me, I need the ability as a patient in a rural community to be able to alert my care team that I'm worried about something. And the easiest way is to take a picture of it, send a text, before I panic and think that, I need to be readmitted, or, I need to go to the emergency department, which we're trying to avoid, then why not start triaging at home? Why triage only in the emergency department? That is how we're going to get in front of unnecessary readmissions or avoidable readmissions. And so for these rural hospitals that need to stay open, we need to stop the closures, because that is also happening as well. So stopping the closures means no more penalties. It means positive reimbursement benefit for keeping your patients healthy. And I'm not trying to simplify it, but there really is an easy, inexpensive, and I would say low touch solution like an asynchronous communication platform, like the one that Rhinogram offers, that gives you the easy way. Why not take the easiest route first? Why not make your phone number textable? Let patients text you when they have a question, when they need care. Then they feel like they're connected to you, even if they live 30 miles away. It's like your next door, right? It's like how they stay connected to family members, grandchildren, kids, everybody else in their lives. That's the start of what the rural health communities have to be focused on this year to keep those patients healthy, keep them in your community.
So, putting your provider hat on, if I'm a provider, where do I start? Do I start with implementing a new technology like a telehealth program, or where do I begin?
So, again, the easiest thing to do, you already have an EHR. We know it. And a lot of people will say, oh, my EHR does that. And I implore all of you on the provider side of the planet, and if you're a patient listening to this, please ask your provider to make it easier for you to get connected and to ask simple questions to manage your care. But if I'm a provider, what do I need to do? I am looking for sure going to go to www.rhinogram.com. But I'm also gonna do some researching around HIPAA compliant patient texting platforms in the market, because what I want to be able to do is meet the patient where they live. So they don't live in my hospital for sure, and I don't want them to.
Mm-hmm.
But where do they live? They live on Facebook. Make sure you get a solution that has multiple options. You know, for those that do have internet access or can get to a library and they surf on,
Right.
and that's how they log into their Facebook account. Great. So have alternate channels for your patient to easily communicate without having to download something new, learn a new tool. None of that. Make it super easy. Find that solution, implement it. Make sure it's light, easy, fast, and again, super simple so that not your staff and certainly the patient feels like they are taking on some huge major IT undertaking. So should have routing capabilities, should certainly manage consent, because that's certainly, you always want to be compliant, and make sure that it can integrate with your EHR.
So let's talk a little bit about, we've talked about portals. So let's compare what the portal does not do. So we've talked a little bit about that. Let's talk more about.
Well, I mean, the portal can work and certainly makes sense for certain care scenarios. Again, if you have internet access, and probably if you're a frequent flyer, so to speak, then you're in your portal all the time. But again, the portal is only usable if you're an existing patient. What happens if I have been one of those folks that have just avoided going to the doctor, but now I really do need to? Now I need to figure out, what kind of doctor should I go to? Are they going to take my insurance, or how much is it going to cost before I get in my car and drive 30 miles? I want to know. And so you do want a solution that allows patients to access you, again, not only by phone, because that never works.
And new patients.
Yeah, if you're a new patient, if I'm out in the field working on my crops, then the last thing I'm doing is sitting by a telephone waiting for some doctor's office to call me back.
Right.
But I have my phone in my pocket for sure, because that's how my family and everybody else and my suppliers, are getting a hold of me. So make sure that you have a solution that also is catering to your potential new patient population, that they can easily text into your practice, whether they've ever been there or not. And we're talking about people that have not, and can ask questions and essentially address their questions and concerns before they ever come in. And now you're engaging. Now you're a new patient engaging, which is also what we need to do. We need to get everybody involved in their care and earlier rather than later. I do believe that we will see this year more legislation and focus around trying to provide broadband service out into these spaces. But this is government intervention, which is good, but what we know is it also can take a while. So don't delay. Find solutions that are out there today, like Rhinogram, like others, but that have the complete patient view, which is your new patients, your existing patients, bidirectional images, pictures being sent bidirectionally. All of that's the start of engagement for this kind of community. So I look forward to seeing more of this being deployed and implemented, and starting to see basically that trend change.
Can't wait to connect. Maybe this summer we can do kind of where are we at on this topic. I think that'd be super interesting.
Love to.
Yes. As always, thanks you guys for listening to us. This is
Kathy Ford with Rhinogram
and Erika Grau, and we are
Talkin Telehealth.
Thank you for joining us today on Talkin Telehealth, recorded at Rhinogram headquarters in beautiful Chattanooga, Tennessee. You can learn more about Talkin Telehealth on the show's program page at healthcarenowradio.com or rhinogram.com. Find us on iTunes under Healthcare Now Radio, or tune in Monday through Friday and listen through your smart speaker by asking, "Play Healthcare Now Radio." Be sure to connect with Rhinogram on Twitter, Facebook, and LinkedIn. We'd love to hear from you. And remember, if it's in the world of telehealth, we're talking about it.